I've come for the Devolution event at the Friends Meeting House in Manchester. My interest is transport, and I want to see how they can make it better for Greater Manchester.
Welcome. It's really good to see so many people here. My name's Mike Wild. I'm the Chief Exec of MAC. We're the support organisation for the voluntary and community sector in Manchester, and one of the things we do is house, accommodate, work with the Greater Manchester Older People's Network. Another thing we're doing at the moment is working on this, which is the People's Plan for Greater Manchester. The key thing is, you're here, this is an opportunity to have a say about the future of Greater Manchester, because that's really what all of this work and all of those organisations and projects is about.
I work for a national charity around housing and older people.
Yeah.
And I was excited to see Greater Manchester getting older people together to talk about things, including housing. So I've come along both to hear what people say and to offer support to this work.
I'm a volunteer for Age UK Salford, specifically to help socially isolated people get the most out of their lives when people that are recovering after bereavement and perhaps injury, and they're frightened of getting on the buses anymore and that sort of thing. And I'm particularly interested on transport improvements.
I'm part of Age Friendly Manchester. I represent Burnage and South Manchester, Rusholme area, and I have to say my say. I'm part of the decision making, which is what makes me come here.
Well, since 2003, I've been working with the social services in Oldham, Failsworth, where I live. Every time we meet elderly people, the biggest topic, or the major topic, is transport, always. But the other side is making sure that the facilities are available for them, they need to stay at home, to get about their area. So my involvement is that, and at 86 I continue working for the younger people.
So, as you know, we've got devolution. What's quite clear is that things in Greater Manchester are changing, and there are new powers coming from Westminster that are now going to be controlled at a Greater Manchester level. So the People's Plan really started by a bunch of people saying, hang on, where's the public's voice in all this? Now, the one thing that is changing is we're going to have a new mayor for Greater Manchester. So obviously, one of the things that happens between now and then is the mayoral candidates want to hear what's going on and what people's views are. The idea for the People's Plan was, let's think of a way to get more people's voices included in this whole discussion about devolution. So whatever you want to say about the future of Greater Manchester, this is an opportunity to do it. So what we've done very, very quickly is type up a few things that have come from all the various tables. So the first one that we've got is democracy. And I think this is a particular thing about our mission for ageing, actually. So it's seen as a democratic way of working. We can improve it by making sure that there's a clearer route from local group to the decision makers in Ambition for Ageing. So I think there's a specific Ambition for Ageing thing there, but also maybe that says something about the way people want devolution to work generally, that you can see where decision making comes from Greater Manchester down to a local level. Number two is devolving resources and support to local areas from an overall budget for neighbourhood decision making. Everybody agree with that? More education about how democracy works, more direct democracy from residents, and make devolution more inclusive. Right, next topic is transport. So, number one, systems work well if you live near a stop or a station. It's more difficult in rural or less connected areas, and there's a lack of evening and night services. Bus passes are extremely important for enabling older people to travel around, to meet people and for services. Private providers and transport strategy seems to have more of an economic focus. Investment is in the city, leading to people working here, and transport into central Manchester is the priority. So health. There's a long list here, so we're trying to get this down to a few things. So, number 1 came out, better access to GPs.
Definitely.
Yeah? So that point is, some of the existing system create a particular risk and discriminate against older people particularly. Right, number 2, training and communications to improve coordination within health and care. So I think that was about the fact that people were saying they've got experiences, you go into the system for one thing, but then something else comes up and you get bounced, over Greater Manchester now. So you can be referred from Rochdale to Fallowfield or something for different things. So next one, there are lots of activities and resources for older people, but only if you know about them. So we need a coordinated way of gathering information about that and sharing it with everyone. And that could be through GPs, district nurses, but all kinds of other things. Is everyone okay with that? Yeah? 4th one, focus on quality of life and care, not just the quality of services. Last one, homes. So space standards, there's a thing about building better quality homes. I remember doing something years ago about the way architecture discriminates against old people. Because it assumes that you don't need space.
Yeah, but what if you're ill and you need somebody to come and stay with you for a while?
Exactly.
That's it. Yes. I mean, are they going to stay in the same bed as you?
Yeah.
Yes.
We won't go into that, but learning I think that's all. And then lastly, we need a GM-wide programme that focuses on warm homes and provides resources for repairs and adaptations, maybe reclaiming. Right, so this is the statement, the set of statements that will go into the plan, as well as all the other notes. But I think these were the key things that came out from the conversations that everybody sort of agreed on, and that several tables commented on something similar, so we've tried to pull it all together. So that's a good morning's work. That's quite a big policy shift for Greater Manchester, right?